Hello everyone, I'm Dr. Mahadev. I'm working as a medical head of Medicover Unit 3 in Health City Vishakapatnam, and we are selecting a topic on diabetes because right now India is been facing a lot of diabetic new cases due to the pandemic, and I'm here to introduce you Dr. Vishnu Vardhan sir, our general medicine HOD, and he's gonna explain us why and how can we get treatment and diagnosed on diabetes. Hi sir.
Hi sir.
Yeah. Sir, can you please brief us on why diabetes is most common and what are the symptoms like that?
Yeah. Hello everyone. So I'm Dr. Vishnu Vardhan, consultant physician, Medicover Hospitals Vishakapatnam. So we are discussing now regarding diabetes. So as sir was telling, diabetes is one of the very most common comorbidities around the world. And even in India, the number of cases are rising every day, day by day. So we have an increasing trend of new cases because of the pandemic, that is COVID. So in the past 2 years, what happened is many of the patients were put on steroids, because of which, even though diabetes was not there earlier, many of the cases were pushed into diabetic range. So now we are seeing plenty of cases, new cases having diabetes. And even patients who were already diagnosed with diabetes prior to COVID, we are seeing that because of usage of steroids, the loss of control in the sugars is there. So now there is an urgent necessity to address this issue.
Okay, sir, nice. And how do we diagnose, or what are the methods of knowing are we diabetic or not?
Right. So before diagnosing, first we should understand what could be the symptoms of diabetes. So if you are in the range of 30s, that is 30 years to 40 years, then you have to understand the most common symptom would be increase in the thirst. So you will feel like you're having thirst all the time, and then you'll be having increased hunger as well. And then at night times you might be having an increased frequency of passing urine. That is, the person might wake up twice or thrice to pass the urine. So these are very common symptoms that a person can have. Along with this, some persons will have weakness as well. And if these symptoms are not recognized, then the person will land into diabetic complications also before even diagnosed with diabetes. So unless and until you focus on these symptoms, you won't be able to identify them, or the better way is to have a regular health checkup, so that even if you don't have the symptoms, or even if you are in the early stages of diabetes, you will be picked up and you will be started on treatment if necessary.
Nice, sir. And I would like to add on, what are the complications? How is our body is getting affected because of diabetes? This is the most I want to get people to aware, what are the complications and all?
Right. So after being diagnosed with diabetes with the help of blood testing, then we also look for the diabetic complications that could have already established. For example, all the major organs in your body can be affected because of diabetes. For example, like the heart, the blockage of vessels in your heart, or maybe the kidney might be affected, and even the liver. Many of the people don't know that the liver would be affected because of non-control of sugars. So other complications could be like your eyes might be affected, which is called diabetic retinopathy, and your nerves might be affected, and that is called diabetic neuropathy. So like this, diabetes affects almost every organ in your body, and unless and until it is diagnosed, we can't go for treatment of it, and you might have problem with the organ functioning as well.
Nice, sir. And what are the dietary therapies or dietaries which we need to follow to reduce diabetes or not go into the diabetic conditions?
Right. So first and foremost thing is you should have an active, healthy lifestyle. That is, if people who are working in sedentary lifestyle, like sitting from 9 to 4, that is not good. So you have to cut down on that. So you should have a healthy, active lifestyle, like playing some sports or going for a jog or swimming. So these things will really help. And you have to maintain your body mass index at a right level. So that is the BMI, which should be at the normal range. And the other most important thing is the diet that you are consuming. First, you have to cut down on the junk food that you might be eating on the roads. And the next thing is monitoring what sort of food are you taking, like whether it's a fatty food or whether it's a protein content or there is increased content of carbohydrates. So you have to take all of the three, but in a moderate amount. So that would be the advice regarding the diet and exercise or lifestyle modification.
Thank you so much, sir. Thank you so much for your valuable information. Me and my audience are like so grateful for you and your knowledge on it. Thank you so much, sir.
Thank you, sir, for having me.
Thank you.